And I would say it's not only important for, workers' compensation, but for any catastrophic case. You really want your patient to be provided care by a team that deals with these problems on a day in and day out basis and understands all the nuances and that variations that people can have and present with. And I'd say the same is true for spinal cord injury and amputation and a lot of these other conditions that all I do is brain injury rehab. So understanding, I feel we have a lot better understanding of how the injured worker, the injured patient with brain injury is going to evolve. And a lot of this kind of goes down to approaching the patient from a neuroanatomical perspective. That is something that most rehab centers, general rehab centers, just don't have the sophistication to do. So the way I'm teaching our staff here is, here's where this person's brain was hurt, and here are the particular issues that this person is going to have with this injured area. And so we can tailor the rehab plan more specifically to what problems that person's going to have down the road. Unfortunately, in the field, a lot of times with brain injury, it's boiled down to mild, moderate, and severe. And you can have 20 patients with a severe brain injury, and all of them are going to have a different and subtle differences in their injured anatomy. And so their progress and recovery is going to be different based on how they were hurt. And unfortunately, I think a lot of facilities don't have the level of sophistication and understanding the neurology of the injury. I'd say the same for Dr. Chen here with the spinal cord injury patients. All he does is take care of patients with spinal cord injury, so understanding those differences and subtle differences and how patients are going to progress, I think that the level of sophistication of care that the patients receive is much better because of that. It's kind of like going to a surgeon, right? You want to go to the surgeon who's done 1 million of these, not one who does one, every 3 years.